Hi there, I'm Curtis Hollister with Phzio. We're a virtual care company focused on virtual physiotherapy. Today I'm joined with Gavin Mosley of Mosley Group Benefits. Thanks for being here, Gavin.
Thanks for having me.
So Gavin, you're an independent benefits consultant, but you've worked at the big companies, you've seen like the large organizations, small organizations. The category of paramedical, that covers physiotherapy, chiropractic, et cetera, has a number of classes and categories, but it hasn't really changed in a long time. People get $500 for this, $500 for that. What do you see as the next generation of paramedical within the industry, and where people are going with it from their needs?
Sure, it's a great question. There's been very little advancement in this area over the last 20, 30 years. As you say, most of the plans are cookie cutter. Not a lot of innovation, and it's one-size-fits-all approach. And right now, I'd say the workforce market conditions have changed. We have 5 generational cohorts of employees, all within the same company. And so a one-size-fits-all approach simply doesn't work as well as maybe it used to. And we're starting to see employees have a demand for more self-driven decisions within the program. And paramedicals is, behind prescription drugs, the most used part of any health plan.
Yeah.
So what we do and how we design these benefits is very important, and people are starting to really notice.
Yeah.
A demand for more coverage. If I'm not using one category, why can't I put that money towards another? Yeah. And any company knows that having healthy employees is good business. And if you have somebody who's dealing with pain or a musculoskeletal issue, and they run out of coverage.
What do they do?
Exactly.
What do they do?
So there's a lot of problems in the current average plan design setup these days.
And I think there's a psychological element for plan members where when they use up their $500, they stop care in many cases. They just kind of like, they don't pay that $100 per session at the physiotherapist or massage if they use it up. They don't keep getting massages after they use their $500 up. So I think the ones that have a real injury in many cases, they need something that extends beyond that for more critical issues.
We see this all the time. Yeah. We can see it in the analytics. We'll see someone going through a tough situation and they'll start to cycle through the different practitioners where the coverage is. And it's hard to say, does it make sense dealing with a back pain issue to use up their massage, then switch to acupuncture, and switch to chiropractor, switch to physiotherapy.
Yes, of
Is
course.
That the right course of treatment for the same injury?
Gotcha.
So having the right treatment the first time and giving the employee the ability to finish a treatment plan without breaking the bank is important.
Gotcha. So let's move on as far as, we're all about employees with pain. A lot of times the paramedical category has really been about rescue-based or reactive-based things. And, the things that we're doing with our virtual care platform include prevention and rescue together. The sooner someone gets access to a healthcare professional, if they are in pain, the quicker they'll deal with it. And there's all these studies that are coming out that show people in pain typically also are experiencing depression and things like that. And there's a big push, obviously, for mental wellness in the organization. I have a feeling that MSK is going to be the next EAP type program. Why is this important to the business?
Well, it's important because it's expensive to have employees off work due to disability. It's difficult to replace them. You can't fire them. It's against the law. You have to still offer them benefits, support them, and accommodate them. So keeping employees healthier is better for the employees and their health outcome, and better for the business's bottom line.
Yeah.
So when it comes to, you have a great point about secondary disabilities. Mm-hmm. So picture this: you have an employee who goes off due to a back pain issue. Maybe they're a lower income earner, they're incurring lots more expenses that they didn't have before, they've been prescribed new prescription drugs that aren't completely covered. And to boot, they're on long-term disability where they're only getting 2/3 of their income replaced.
Gotcha.
So they're making less money, their expenses are higher, and now their physiotherapy maximum has just run out. And we're telling them, you should really go see somebody. It's not a great solution the way that the plans work right now.
Yeah, no employer, I think, wants to abandon their employees this way. It's just this is how the plans are designed. Yep. This is a big machine that's moving in this direction. So kind of bringing it back to virtual care. There's lots of different flavors for virtual care right now. It's just an emerging kind of market where, the initial players were, you can talk to a doctor whenever you want, that you don't have to go to emergency kind of to get a prescription in some cases. There's lots of changes happening in here from the point of view of employers being like forward thinking or reactive. What does virtual care look like 3 years from now for a lot of the plan sponsors?
I'd say the trend isn't going to go away. There is demand for it at the employee level. If someone needs to have an issue triaged, looked at, treated, does it really make sense for them to take a half day off to potentially drive somewhere, pay for parking, perhaps, go see a therapist, come back to work maybe that day?
Yeah.
I think, and especially people's comfort with technology.
Yeah.
If they don't need to be touched, I think a lot of people will eventually see the efficiency and the ease of use and the compliance with treatment programs will increase.
Right.
Most employees and employers that I work with, don't have the luxury of having a clinic in the same building.
Yeah.
So it's usually the case you have to go somewhere and take time either away from work or away from your family, which no employee wants to do.
And what happens is, and our experience has been, people just don't do it. So they've got something that's like an injury or some issue. They've got a cold. They've got, it gets worse and worse and worse. Let's say it's a hurt shoulder. Like I know when we're selling to a lot of partners and carriers and so forth, almost every single time we've got someone in the room that has something that's hurting on them. And so it's a prevalent issue, and I think that we don't have to necessarily change how much money we're spending. In fact, it might be more cost effective to use some of these technologies, but we have to change the culture in the organization that we want our employees to be proactive about these things.
Absolutely, and I think if it's easier to do and less timely, I think we have more people using it, and I think the key is not replacing what people are doing now necessarily, but we're not, with a virtual healthcare provider, we're not saying, well, this is the best and only option, you should only use virtual.
Right.
It's supplementing the physical.
Yeah.
So there's going to be times where you still need to go see a doctor face to face, they need to touch you, or see a physiotherapist face to face.
100%.
But there are times where you might not need to see them face to face, and who can disagree that the time savings, the money savings, the not having to put a heavy coat on and go somewhere, why would you do that if you don't have to?
Yeah, now the research really supports that. I agree. So, just another big issue, we touched on it a little bit earlier, and that disability cases. Some employers have occupational, like a workers' comp type situation, but they also do non-occupational injuries where they'll have a company manage the person back to care. Some of these short-term disability cases, it goes from weeks or a month into months or sometimes longer, are the scary ones for the employers and for the individuals themselves. Does virtual care play a role for these long-term disability patients? And is it a cost savings? Like, how do you see it being relevant?
I see it as being very relevant. I think everybody's goal is to have a healthy employee not in pain and productive at work. I think the employee, the employer, benefits world, we can all agree that that's what we want, and there's a lot of different ways to get there. I think the landscape right now has made it harder and more prohibitive for certain classes of employees to achieve that on their own with the cookie cutter plans that are out there. So we talked a little bit about it before, where compliance is an issue, and when you add financial stress to a physical injury, having the choice of, well, do I comply with my program? Do I continue to go see a practitioner once I've run out of coverage? Yeah. Can I afford to do this? We don't want a disabled employee who's maybe disabled for the first time, doesn't understand the process, scared for the future.
Probably quite frustrated too.
Dealing with all sorts of forms, being tossed around by insurance companies, getting letters and legalese. And now we're saying, well, now you're out of pocket to get better. And so if we can help solve the choice that is heavily dependent on someone's ability to pay, well, why wouldn't we provide that solution to employees who need it most?
and really combine that human compassion, I think, with new data that allows us to make sure that the employees that are trying to get better are getting better, they have access to the best people. And the challenge in a lot of cases, or a good case for virtual care, is if the best healthcare professional is 200 kilometers away, well, it'd be great to be able to connect that employee with that provider.
Yeah.
And it'd be great to say if this employee is doing their therapeutic exercises or their therapy, that we've got line of sight to the compliance or the adherence with that as well, so that malingering doesn't become an issue, because it is a big cost point when it does happen.
Yeah, absolutely. Yeah, the remote point is huge. If you don't have a therapist close by, you can bank that it's not going to happen.
Well, awesome. Thanks so much for making the time, Gavin. You've been one of those guys that are always looking at what's next in the industry and kind of coming up with new products and really leading that as an independent. So kudos to you.
Well, thank you very much. I was very happy to be here.
Okay.